Hi everyone, I'm Natalie Colabianchi. I'm from the School of Kinesiology, where I'm an associate professor in the Applied Exercise Science program. And very generally, if we talk about what does my research look at, it is documenting that where you live affects your health. And so we're interested in knowing what are those features in the neighborhood and community environment that is associated with health behavior and chronic disease. And then more importantly, when we can, if we make modifications to those features, do we see changes in health behavior or health outcomes? So I thought, just to kind of give you a sense of what I do, I'd give you a very generic research finding. So children with more parks in their neighborhood are more likely to be physically active, and kind of extend from there. So we've done a lot of work with children, but we've done a lot of work across the age span. We look at parks, but we look at a lot of different features in community and neighborhood environments, like street connectivity, food price, land use, crime, and micro-scale features as well, sort of, do you have quality sidewalks? And typically we do this by aggregating secondary data sources and putting them in a GIS, but we've also gone out and done direct observation, where we go to parks or go into people's neighborhoods and we collect this data. We've also used Google Earth audits. We've used an apparatus that was developed by NASA called GigaPan. I don't know if there's any photographers out there, but it takes high-resolution panoramic photos. So we've done this in neighborhoods and then coded features from there to see whether it's as reliable as going out there in person. As Veronica talked about, so children with more parks in their neighborhood. So we toss around that term, but we have to quantify that in some way. In my previous slide, I said, is your zip code more important than genetic code? Well, no one does zip codes, of course. It just happens to go well with genetic code. So we do lots of things, like Veronica said, where we make lots of different buffer sizes, and we try to say, well, where is the biggest effect? But we've tried to do other things. We've asked kids to draw out their neighborhoods, tell us what is the salient scale that you think of when you think of your neighborhood. We've asked people to keep travel diaries, and we look at the locations where they're active, and we try to define these physical activity spaces. We've started to do some work with GPS traces, knowing where people go, and is that the relevant spatial scale? But of course, one of the tricky parts of that is the features in where they typically travel driving their behavior, or is their behavior determining where they're going to travel to? And then in terms of outcome, I am in the School of Kinesiology, although I'm an epidemiologist by training. I typically am looking at physical activity behavior, usually measured via accelerometry, but also do direct observation of physical activity, as well as looking at some other outcomes. So I was doing the 3-minute pace, so I think I can slow down a tinge. 2 examples, because they're quite different. I have an NIH study that's sort of large scale. It's on a national scale. We have 5,000 kids who have 10 years of BMI data in 130 communities. And we look at a variety of factors that are associated with their BMI trajectories. I think these studies are important. I think the national scale is great. It gives us lots of variability. But when we look at things from park availability to obesity, there's a long causal chain in between. So did they use the park? If they were at the park, were they physically active? What determines whether they go to the park? So a second stream of research, which is not federally funded, more internally funded, is getting more fine-grained detail. So really understanding the context in which behavior occurs, in particular physical activity. And I'm particularly interested, but at the beginning stages of starting to think about how some of the changes in our transportation systems are now affecting active transport. In terms of teaching, I teach 1 class a year, yay. And it follows my research even better. So I teach a class on environment and policy approaches to increasing physical activity. It's in the winter. I would love to have some students outside of kinesiology take this course. I get a handful here and there. And then in terms of civic engagement, I do participate in 2 statewide organizations that are focused on changing obesity and physical activity levels in the state. I also was a member of the Bridging the Gap study, which was funded by Robert Wood Johnson, and I like to point to this as a great research experience. We had monthly calls. We had the researchers, us on the call. We had advocates and community groups, and we would talk about policy levers and what we should be developing and what we thought the communities wanted, what we thought was actionable and actually possible that we could get this passed. It was a really great program. All of our scientific articles, we were somewhat required by Robert Wood Johnson to write a policy brief that could go along with the article for distribution. And another piece of civic engagement, I was asked by the Society of Behavioral Medicine to co-write a policy brief for a senator that was introducing some considering introducing legislation around parks, and she did not get reelected. So there's that. Thank you.